Hi everyone, Assalamualaikum warahmatullahi wabarakatuh and welcome to IIUM TV. So I'm Fakhruddin Hassani
I am Arisha Zahir.
and we are the host for the brand
Peeps
new
Chat
season Peeps Chat
Chat
Show. So healthy peeps?
Happy Chat.
Yeah, okay. So maybe most of you we question what is Peeps Chat. Actually, this is the latest show which is replacing the Sport Space in the previous season. So I'm the host from Sport Space and also this is my new partner for this season. Okay, so for Peeps Chat, before we introduce our guest and our topic for today, we would like to
Yeah, we would like to thank our sponsorship for providing us the facility at this studio.
and also don't forget to tune to our IUN TV YouTube channel and subscribe and also thumbs up in the YouTube channel. Also don't forget to follow Instagram, Facebook, Twitter, and if you miss the episode, you can tune to the Spotify and search our podcast in the Spotify. Just type IIUM TV. So Arisha, for today, what is our topic actually?
Yeah, our topic is very interesting, which is mental health. So it's a very common and we are currently raising the awareness of mental health issue. And
Yeah.
it's not just the two of us. We are going to talk this topic with a special guest. Please
Yeah.
introduce yourself.
Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Shamil Sophia. I am a postgraduate student, currently doing my master's in clinical and counseling psychology, inshallah, here in IUM. Yes.
Yeah. So where are you from?
I am from Kuala Lumpur,
Kuala Lumpur.
born and bred here.
Oh, Alhamdulillah. So KL.
Yes.
Very
people.
near.
Yeah, my house is only 15 minutes from here.
15
So yeah,
minutes.
Okay.
Okay.
So you want to give the address of your house?
it's okay.
Okay, just kidding.
Okay, I know.
Okay. So we're gonna talk about mental health, and the first thing is actually maybe many students or maybe people everyone who's watching this maybe we don't know or we definitely don't know what is actually mental health.
We
So,
are still confused. What is
yeah,
mental
we are still
health?
confused. So to begin this discussion,
Okay, with the
maybe?
first question, what is mental health issue and what are the factors causing mental health issue?
Okay, thank you, Alicia. Right.
Yes.
Mental health issues or mental health concerns is basically changes in someone's emotions, behavior, and also thinking, right? And normally, when someone has changes in these parts, they tend to act abnormal from other normal people, how they act, right?
okay.
And there are a lot of factors that affect someone's mental health well-being. For example, first of all is hereditary factors or genetic. Right. Normally, if you have a family member who has a history in mental issues, normally there's a possibility that the child may have also, right? May have the disease also or the disorder. And apart from that, also there's changes in brain chemistry, right? For example, we know generally we learned in biology in Form 4, Form 5, when you have like, for example, neurotransmitters, all these things, right? So when someone is abnormal, basically these neurotransmitters, they're not connecting well. Yeah, in other words, layman terms, right? There are also other risk factors. Among them would be stress. Stress is normal.
Yes.
But what's abnormal is severe stress.
Severe stress.
Severe stress.
Severe stress and also traumatic experiences. For example, childhood abuse. Sometimes people who are, for example, bullying. And also, if someone has few healthy relationships, let's say, for example, someone does not have good relationships with their parents, or also does not have a lot of friends, also has broken relationships with other people, for example, in terms of their partners, that contributes to a higher risk of getting mental issues.
The bad experience.
Yes, the bad
So
experience.
basically, from majority comes from bad experience.
Yeah, I would say the first would be severe stress.
Severe stress.
Like we sometimes we're not able to how should I say, manage
Manage.
stress levels. And when it increases, it's like cancer. If it's level 1, normally there's a higher possibility for you to be cured,
Oh,
right?
okay.
But you're in level 4, normally you would understand that, oh, maybe the person would have a harder time to live. Similar to mental health issues. The higher your stress, the
Oh.
harder it is for you to cope with it, or cure it, yeah.
Oh, I see.
Okay.
So how can we know that someone having the mental health issue?
Maybe symptoms.
Yeah,
or
the
Yes.
something?
symptoms.
There are a lot of symptoms. First of all, normally a person feels very sad, down, blue. There's something called as anhedonia, where an activity which you find, for example, joyful to you. Let's say, for example, Fakhruddin, right?
Yes.
What do you normally find joyful? Or what do you enjoy doing?
Maybe watching a movie.
Oh, you like watching movies?
Yes.
Oh, okay. Alicia?
I would listen to musics that I like.
Oh, okay. So the genres that you like lah, music,
Yes.
right? So anhedonia is when, for example, Fakhruddin, you like watching movies and you like listening. These things do not bring joy to you anymore.
Oh.
Yeah, that's one of the symptoms to show that you might have mental health issues.
Okay, so we can say that it's abnormal, right?
Yeah. Normally, if
Oh.
you're tired, if you do these things, it'll make you happy.
Yes.
But people with severe issues, for example, depression, when they do these things, they don't find happiness and they tend to be down all the time, right? And there are other symptoms also, for example, extreme mood changes. Sometimes, have you seen a person suddenly extremely happy, suddenly extremely sad, for no reason? Have you met such people?
Yes.
Oh.
Her.
Really?
Just kidding.
Okay. But normally, when you meet such people,
Okay.
like sometimes you're talking to the person and the person is so happy and laughing and suddenly the person goes very sad. There's a possibility he or she has mental health issues also, right? And apart from that, you also have suicidal thoughts, right? This is, I would say, suicidal thoughts happen when you're not able to cope with your stress, and you do not acknowledge that you have stress. There's suicidal ideation in psychology, suicidal attempts, suicidal ideation, suicidal thought, and suicidal attempts. Ideation is when you just imagine. You imagining yourself taking a lot of pills is also a sign that you need to seek for help.
Okay, so we can say that there are many symptoms that we can conclude.
Yeah.
So for the next question, actually, I want to ask, what are the ways to avoid ourselves from getting mental illness? But don't go anywhere.
Because
You will answer after this,
yes.
and inshallah, you
Yeah.
can drink water, and then you can go to Ion TV later.
Yeah.
Banana are curved because they grow towards the sun. Because they went through a process called negative geotropism, instead of curving to the ground, they curve towards the sun.
Spiderling is a baby spider. It is an official name for the immature spiders. On top of that, they were born in a group of thousands.
Banging your heads against a wall for 1 hour burns 150 calories. Samsung means 3 stars in Korean. It was chosen by the founder because he wanted the company to be powerful and everlasting like the stars in the sky.
The world's first motel. It was built in 1925, located at San Luis Obispo. It only cost $1.25 just for a 2-room bungalow and an adjoining garage. You know what? This was the best motel forever and ever. Back to the future!
Fun fact, if you have an issue with your car remote control, you could point it over to your head. This would increase the signal of the remote control, and as your brain work as a radio transmitter.
There are more muscles in an elephant's trunk than in the entire human body. There are about 40,000 muscles in the trunk of an elephant compared to human body who only have 600 muscles.
If you lift a kangaroo's tail off the ground, it can hop because kangaroo use their tail for balance while hopping. Without their tail, they would have no balance and fall over.
Okay, first fun fact is starfish are brainless. Why? Because you know why, right? I know why. Why? Because they lack centralized brain,
Okay.
but they are still sensitive to light and
Yes.
touch because they still have nervous system.
Yes, you are absolutely correction.
Yay! Some cats are allergic to people. In every 4 people who are allergic to cat, they may be allergic to you.
We are back to our show, Peeps Chat, Healthy Talk,
Happy chat.
Happy Chat. Is it true? Is it the
Happy,
true?
happy Peeps Healthy Chat.
Yeah, this is the first show, right? We are
show.
still awkward. Okay. If
Still
you guys think
practicing.
we are not good, it's okay. We will improve this later. Okay.
Yes.
So back to our discussion. So from the previous question.
Kudin, before we move on, I would like to thank our sponsorship for
Oh.
sponsoring us the furniture.
Yeah, the
Yeah.
furniture in the studio.
Yeah,
So
in the
thank you to
studio.
Jatimas. Thank you very much.
Thank you very much.
Okay, so back to our question. As I mentioned just now, what is what is the way to encounter this problem to having the symptoms or anything?
Okay, so if, for example, you think that, but basically, it's not possible to prevent mental illness. Like, it's not possible for you to prevent yourself from cancer, for example, right? So there are, what I would say is, if, for example, you find that you have such symptoms, there are a few things that you can do. Well, first of all is you can pay attention to the warning signs. Let's say when you wake up, you don't feel energetic, you feel sad all the way, you cannot cope with your stress, then it's high time that you meet a psychiatrist or a clinical psychologist or the university's counselor, right? And also apart from that, you need to seek for help when you need it. I know sometimes it may be hard for people to find friends, especially those with issues, but it's really, really important to have support system. So whenever possible, try to make friends, find those who are really close to you, could help you. They would really help in terms of improving yourself, right? And also, this is the most important. Everyone could prevent from this in one way or another by taking care of yourself.
Yeah.
Self-care is really, really important. I think nowadays we tend to not do that. For example, having sufficient sleep. Students sometimes think that the indicator of success is sleeping at 3 a.m., waking up at 6 a.m., then I've studied a lot. But that, so you know that the lesser time you take to sleep, the lesser your body is able to function.
Oh, okay.
And less sleep contributes to a lot of mental health issues also.
Oh, so is it the less sleep contribute?
It tires you. It does not directly give you depression, but it would, for example, make your body tired.
Okay.
Later, it will be harder for you to enjoy things. Similar, if you don't go, people tend to not do exercises nowadays. Go and jog because physical exercise really helps to reduce mental health issues.
Okay, is it from the what we say Islamic perspective or Islamic practice? Is it that's the way to avoid this?
Yes, I think there's an idiom I think I learned when I was younger. Al-wiqaya khairu min al-ilaj, right? Which means prevention is better than cure.
Yeah.
And I think that Islam has already talked about this, how it's important for you to take these measures. And these measures include very simple things. You wake up, make sure you have breakfast. People skip, including me before, skip their breakfast.
Brunch.
Yes,
And
which is not good. And that it's not. You should have regular meals.
Yeah.
Because those meals that you think you are skipping because you are too busy, it will cost you your mental issues. So in Islam also, from the Islam perspective, it's also really important for you, personally for me, to pray regularly.
Oh, okay.
There's a difference between a person who prays and a person who prays on time,
Yeah.
right? And I believe that when you pray on time, it will really help you regulate your whole schedule every day.
Oh,
Yeah,
okay.
it will help you in a way. Yeah.
So maybe we can say istiqamah, then it can help us actually.
True.
Yeah,
Sure.
okay.
So the next question is, have you ever encountered with people that having mental health issue?
Yes, I have. I have met a lot of people with mental health issues.
Can you tell some experience?
Oh, okay. Basically, I also volunteer for an NGO.
NGO.
It's called the Mental Illness Awareness Support Association, or MIASA, right? And I was given the experience of conducting this test, a screening test, to see whether the probability for you to have depression, anxiety, and stress, right? Or depression and anxiety, sorry. So based on the very few experiences I have, a lot of people nowadays, even in KL only, they face a lot of issues which are not coped well, right? And a lot of people nowadays also have a lot of, for example, one of the most prevalent cases is major depressive disorder, generalized anxiety disorder. These are the two most prevalent. Yeah.
Okay.
So, if we have friends like that, how can we help them with their mental health issue as a friend?
Okay, so basically, first of all, what you can do if you're a friend to a person who has mental health issues, try talking to the person. Try talking about mental health to the person. But when I say talk about mental health, it does not mean go and preaching, talking about you're not good, you'll be bad and stuff. Not that, right?
Not soften them, right?
No, you're not imposing your ideas on them, right? When I say that, it means when you go to a person who has severe stress, for example, ask the person, what are you feeling, and then listen to what the person says. Sometimes I've met people who have friends with mental health issues and they find it hard to listen all the time. They find sometimes that people with mental health issues, they tend to become, I would say, reliant, and dependent. So that's why, as a friend, also one of the things that you can do apart from talking, is to strongly suggest your friend to seek for help. Remember, you're only a friend. You cannot give therapy. You don't give advice. You ask the person to seek for help.
Maybe assist them looking for help.
Yes, exactly. There are a lot of places that you can go. For example, you can go to this, in Malaysia, we have the Pusat Kesihatan Mental under the government called Mentari. In KL, you have one in Selayang and in Putrajaya. So, yes, it's really important for you to seek for help. Right.
So in Selayang, which is the hospital or?
No, so Mentari is like, you know KKs? Klinik Kesihatan, Jalan Klinik, right? So Mentari is an example of a KK, but it's a mental health clinic.
It's focused on mental health.
Yes. So in every Mentari, they have each state in Malaysia has a Mentari or at least two Mentaris. So in Selayang, for example, you will find a psychiatrist, a clinical psychologist, and you can come and they would give you a number and they will just talk to you. But people do not really know this, so it's important. It's good that you guys do this so that it increases awareness in a way.
Okay, is it the what we call the Mentari? We can say that it's a psychiatric clinic or?
More or less, something like that. Yeah. They give you help. They provide help for this apart from going to hospitals. Yeah.
Okay. Thank you for your information. So many new information that I got and you also can got from this. So we're gonna have our commercial break, our last commercial break. So don't go anywhere. Chill, lepak dulu. See you after this. Tune to IUM TV.
Imagine today is 2020. What will you see yourself in the 15 years later? Hi sister, can I know what you will be in the 15 years later?
I will be a kindergarten teacher.
Hi Aiman,
Hi.
what do you see yourself in 15 years later?
Maybe standard officer.
Assalamualaikum. My name is Muhammad Ridwan, and inshallah 15 years from now I will see myself as a person who has a big family.
In 15 years, I've already have an essay own car, fully purchased, and already bring my parents to Umrah, my families also, and I've traveled around Asia. That's all.
In 15 years, I think I probably already secured a job, having done my PhD and also probably married with kids.
Next coming 15 years, I want to go Umrah with my parents also. Continue my career as a counseling psychology. Want to buy a house for my parents, of course, and for me, buy out my dream car also.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Wan Ahmad Izam Hassan. I'm from Kuliah of Engineering. Okay, for the next 15 years, I do hope that I got a good job, getting married, and also have a cute children, son or daughter. Okay, that's all. Thank you.
Okay, maybe after 50 years from now, maybe I will be a teacher, inshallah. Teacher for teaching Al-Quran. And then maybe if I married, maybe I have 4 sons and 2 daughters. It's many, right?
Thank you.
Thank you.
Hello everyone, we are back in PEEPS Chat. Healthy, is it? I still
Happy
confused.
Peeps, healthy chat
Happy
today.
Peeps, healthy chat. I'm so sorry.
Because we are happy and then we are going to have healthy chat.
Yeah, we are so happy because we're having you as our
Viewers.
viewers, yes. And
Yes.
also we are happy to be your host for tonight and for the next episode also. So if you bored about us, I'm so sorry. Okay, so we're gonna move to our next, what we call next part of our discussion. So Alisha, what
Yes.
is actually?
Yeah,
next
I
part?
want to ask sister if is it common in IUM to have mental health concern for the students?
Yes, it's really common. Just for you to know, everyone in 5 adults in the whole wide world has a mental health issue. So in IUM itself, there are a lot of people with mental health issues. It ranges from depression to anxiety to even schizophrenia. Schizophrenia is basically when you have delusions and hallucinations. You listen to things, you see people who are not really there. Yeah, see images which are not really there. So that's schizophrenia.
Also, that's why we can see that some people talk alone.
Yes,
Yeah.
if you see normally, okay, this is just a bit of stigma. Like you see people walking by the side or walking by the street. Sorry, and the person was like talking to themselves, and you start saying, "Oh, orang gila ni, this is a crazy dude," something like that. Well, the person is not crazy. He most probably has schizophrenia. He could not control between reality and fantasy. That's why.
But he is not under medication.
It depends. There are people who are, for example, in UAE also we have students who have schizophrenia, right? But normally when you're educated, they will tend to get treatment. If you are under medication, it's easier for you to control the thoughts and emotion and delusions, hallucinations. Yeah.
So the students of IUM, if they are having those mental illness, mental health concern, how can they seek for help in IUM?
In IUM, first of all, what you can do is to see the counselor, right? The counseling unit, they provide counselors, a few of them, and normally also when you talk, they would also be able to give you the DAS test just now, the depression, anxiety, stress test. Also, if you find it really hard, for example, I've met students who find it really hard to cope, they go to the doctor, the IUM clinic, and the doctor will prescribe, for example, medication for that time, and will give a referral letter to the hospital.
Oh, okay. So in the IUM clinic also, we have this unit.
Basically,
this
doctors,
field.
doctors are known as general practitioners. They cannot give you diagnosis, but they can tell you, for example, okay, your condition is getting kind of worse. I'm going to refer you to HKL. So I had someone I knew who was in really bad shape, attempted suicide. So the IM clinic actually brought her to the hospital using the ambulance lah. So that is such. You can go to the clinic also. And apart from them, one more is under the Department of Psychology. We have the Psychological Services Unit. Normally during the short semester, I'm doing a master's, right? So we will be doing our practicum for one semester, the short semester here. So we will be close to the short semester. We will be advertising anyone who wants to come and get a diagnosis. Then you can come to the PSU. It's at level 2 of HS. And you can come and see us, and we will give you diagnosis and help, consultation and stuff.
Answering the test.
Answering psychological tests.
Psychological test. I see.
And also getting a diagnosis, getting treatment, and so on and so forth.
Okay. Actually, for IUM students itself, or also for students, general students, they say that actually men have a high percentage to get this problem. Is it true?
Yes, it's true. I don't know. The thing about men, men, is they are very secretive. I know it's maybe because of this sounds really sexist, I guess, but I think men, they are born in the Islamic perspective way to provide protection
for women,
to women and people around them. And that's why it's harder for them to open up. So when I, for example, administer DAS to men, although their anxiety, the probability for them getting anxiety is extremely severe. When I ask them, for example, in Malay, Encik, okay, jadi kita tengok result teruk, what should we do? And then the guy would be like, my life is normal, it's fine. And I was like, so I guess men sometimes they don't, but it's, Alhamdulillah, the awareness has increased. More men trying to seek for help, right? And I applaud men who also are open to receiving advice from other people, especially therapists and counselors.
So maybe after this, I need to do the dust test. Okay.
Don't act like you are tough. Okay, Kudin.
Maybe that's because of ego. Sorry for men. I just giving my opinion.
I don't know. Well, maybe
it's okay. You're a man.
Okay. So, I consider addiction is part of the mental health.
Yes. In mental health issues, among mental health issues is substance use disorders, right? I know in IUM a lot of people take weed. Since I took my degree here, a lot of male, female, a lot of them take substance, right?
Yes.
So substance abuse is one of the major concerns, because basically when you're addicted to something, you increase the neurotransmitter called dopamine. In other words, in the layman term, it increases the pleasure in you. That's why you want to do more.
So if we take a little bit, after this we will take more.
There's a possibility that you take it more. That's why you're addicted. It's similar to porn. Yeah. Pornography is also addictive. Because pornography, it actually increases your dopamine level, and you force your body to increase other things, such as, for example, testosterone, and other these happy seeking, pleasurable feelings, right? That's why I've met also students or people who cannot stop from watching porn. Like they have to watch it every day because of this.
So there are many info actually for new info. So we can say that addiction is a part of this mental health issue. So actually we are at the end of our show. So thank you again for
Thank you to our guests.
Welcome.
Yeah.
So we would like to thank our sponsor for sponsoring us the facility in this studio.
And also don't forget to tune to our channel every Wednesday
8 p.m.
8 p.m.
Yeah, on IUM TV YouTube channel.
And also don't forget to follow our Facebook, Instagram, Twitter, and podcast in Spotify. So we're gonna see you again next week for after the next topic is what you want to know. So
stay tuned
for next week. Okay, thank you. Bye.